Women have been giving birth for centuries, so it's a pretty natural experience, right? Wrong. I'm Stephanie King, professional doula, childbirth educator, and the creator of the My Essential Birth course, the online childbirth education course that's helping women everywhere confidently achieve their best birth. Today's culture would have us think that birth should be treated like an illness or an emergency, and that most of us need other people telling us what's best for our bodies because we aren't the experts. So sit tight, because if you're tuning into this podcast, you'll probably start to believe in your body, your intuition, and find yourself empowered and confident to do what it takes to have the birth of your dreams. If you like listening to me take you through these weekly topics step by step, then you're going to love the My Essential Birth course. Make sure that you're subscribed to the podcast, and definitely head over to myessentialbirth.com for the free downloads mentioned right here in these episodes, and to join the birth course and community full of pregnant moms just like you. I have to add a disclaimer that I am not a medical professional and I cannot provide medical advice. All of the information expressed in this podcast are based off of personal, professional, and educational experiences and are my own opinions. Please work with a provider you trust for medical advice during your pregnancy and birth. All right, welcome back, and I'm excited for this week's episode, as usual. But I want to start with a review of the week. So this one is Jaguar9, and she says, "So thankful. I can't say enough positive things about this podcast. Educational, organized, captivating, empowering, charming. Currently at the end of pregnancy number 5 and finally feeling like I know all the things and am equipped for labor and delivery. Thank you for providing a much needed resource. You are changing our world and our birth stories." And then she's got some clapping emojis and whatever this one means, like, yay, you did it. Good job. It's the 2 hands, like, since you guys, I part of me is like, I'm on video, you can see me, but I'm very aware that I'm on a podcast as well. So anyways, thank you so much for the reviews. You guys, if you have not left a review yet, this is the number one way that you can say thank you, or this is awesome, or I want other people to find this show. So please go leave a review today. But let's get into this week's podcast. Oh, also really quick to Jaguar here. I want to be really clear that, like, it was 3 pregnancies for me by the time that I really felt equipped. Like, I really knew what I was doing. Like, it was really, and that was my very first unmedicated birth. And even at that, like afterwards, and I'm like, holy cow, there's still so much to learn. I think every pregnancy, every birth gives you more opportunity to learn a little bit more about birth, about the process, about your body, about yourself. It's an entirely kind of like all-encompassing thing that we do as moms. It's incredible. But today's episode, let's jump in, because I'll share a little bit about, like, when I was pregnant with my first baby, I had no idea there was anything other than an obstetrician. And so if you're following along here, maybe this is the first podcast of mine you're listening to, this might be the first time that you hear it. A lot of you already know about midwives, and that's wonderful. But I know that there are thousands, literally tens of hundreds of thousands of women that have no idea that you have any other option other than an obstetrician. And an obstetrician might be a great option for you, but you should get to choose, right? You know how I feel about that. But anyways, I felt like, well, even for myself, I assumed, because it's what kind of we're trained up to do, especially here in the United States, once you have any kind of menstrual cycle, you are sent to an obstetrician. This person deals with menstruation and hormones and any pain in your abdomen you're having, or anything weird like that. That is who you go to prior to having children. And so when it's time to have a baby, they also deliver babies and meet you at the hospital and take care of your pregnancy and take care of you postpartum. So it's this natural progression, especially for women here in the United States, to go from an OB to an OB when it is time to have your baby, period. And that's where my head was with it. So what happened with me, though, was it wasn't until I took a birth course and learned about midwives in this birth course, because I wanted to have a more unmedicated experience, a more, in my opinion, natural progression of birth experience. And so when I took a birth course, they talked about midwives. And then I decided at some point to switch to a home birth midwife. Now, maybe you've heard my story, maybe you haven't, but with my first, I had a cesarean birth with an obstetrician, obviously, and a hospital. My second baby, I got educated. I really wanted to go unmedicated. We were overseas in Germany. And so I saw an obstetrician for my care, but it was the midwives who delivered the babies. And so I didn't see my obstetrician at all, except for him to come in and say, hi, how are you doing during my labor? And then he was gone. And so midwives were the norm there. And I was grateful because now I knew about them and that's what I wanted. And then when we moved from overseas back to the United States, we moved to North Dakota. And there was one hospital nearby our area, 30 minutes from where we were. And they basically told me, we don't care that you've had a vaginal birth after cesarean for your second baby. You need to plan on having a cesarean birth for this one because you had a cesarean birth at all prior. And I was like, whoa, hold up. Like, I did all this work. I know it's safer for my baby to have a vaginal birth again. I'm not doing that. And so what I did is from Germany, I started looking into home birth midwives in North Dakota. And I am embarrassed to say that the questions that I was asking, and they're not bad questions. I shouldn't really be embarrassed by this, but I felt a little taken back by some of the responses. I started asking questions like, who are there home birth midwives? And they started naming people. I'm like, well, like, what's their licensing? Like, what training do they have? What certifications? I was asking about all of those like paper documents. And sometimes those can be really good markers, but particularly in North Dakota, and I'll get into this a little bit later, my midwife was a direct entry midwife because licensed midwifery in North Dakota at that time, I haven't looked into it recently, I assume it's probably the same, was illegal. And so she wasn't what's considered an underground midwife. Underground midwives are midwives that have licensure and work outside of that license in ways that maybe the state doesn't, they can get in big trouble for misdemeanors, all of that kind of stuff, or felonies. Literally, this is a thing, you guys. If you're hearing this for the first time, maybe some of you are blown away. But I was asking about all these like licensures and certifications and what does this midwife have? And there were a lot of people that were like, she's got like hands-on training and she's delivered this many babies. And like, what does a license do for somebody? And there was this whole conversation back and forth. And I was just sitting there like, oh, like I had no idea. And I feel so dumb. And anyways, I was embarrassed enough by the conversation back and forth that I ended up going onto that forum and I deleted all of my comments. But I also grabbed the midwives' names and numbers and interviewed and ended up using one of the home birth midwives for my home birth and had an incredible, incredible experience. Was she skilled? Absolutely. Did I trust her in that space? Absolutely. Was she prepared for emergencies? Absolutely. Did she have licensure and certification? No. And in fact, in her case, she chose not to do those things in order to help women like myself be able to birth at home safely. So that's why, in case you're wondering what these different providers are, we've got obstetricians and midwives, and then there's in-hospital and out-of-hospital midwives. There's licensed midwives and non-licensed midwives. And then we've got medical doctors. These are all people that can attend your birth. And I want to go over what the difference is, because a lot of times it's like OB, midwife, that's all we hear. Which one do we want? A lot of times both are attributed to hospitals, or maybe midwives are only attributed to out-of-hospital. All of that I want to get through in just a little bit today. So I want to start with an obstetrician, because the majority of you listening, whether you're choosing to do unmedicated or not, are probably meeting with an obstetrician or somebody who can help you give birth in a hospital. And this is the probably number one biggest, at least here in America, that people have births with. So an obstetrician is someone who has taken special training to care for women primarily before, during, and postpartum with the pregnancy. And their job is to care for health of mom and baby, particularly during pregnancy and such. But an obstetrician also deals with any kind of surgeries that mom might need. And this can be prenatally or postpartum, but this would be things like tubal litigation. So in other words, if you decide not to have babies, they can remove your uterus or do a hysterectomy. They can do a D&C or a dilation and curettage if you have a miscarriage or for other reasons. They perform all kinds of medical procedures and surgical procedures on top of just caring for and treating women. They can also provide hormones and all that kind of stuff. So let's talk about some of the training that goes into that. Your obstetrician has had to obtain a bachelor's degree. A lot of them choose to get their licensing in one of the sciences because there's a lot of science that goes on for their testing and stuff. During their junior year of that bachelor's year, they need to take something called the MCAT, or the Medical College Admissions Test, and then they can apply for medical school. So they're working on their bachelor, they apply for medical school, and then they can, if they get accepted, they move on to a medical college or university, and those places will have different prerequisites. But generally, you're going to start with, once you've got your bachelor's and you move on to medical school or medical training, you got 2 years of academic studies, and then that's followed by 2 years of clinicals or hands-on work. So during that time, clinicals and hands-on work, obviously they're working side by side with other providers. They're working specifically with patients, and they're hopefully and probably gaining a ton of valuable skills and knowledge during that time. The final step for this provider is to complete a residency. So once they've done their 4 years in bachelor school, and now they've got their 4 years in medical school, now they have a 4-year residency training. This is where they are under the supervision of an attending physician. And they also have to work on and receive their certification with the American Board of Obstetrics and Gynecology at this point. Overall, it is 12 years of schooling. So as you can see, there's a lot of academics. There's some hands-on. Residency is very hands-on. Like, you're taking your own patients. You've got somebody overseeing you. You're training, you're learning, all of that kind of stuff. All physicians, including obstetricians, have to be licensed to practice as a doctor in the United States, and they do that by taking and passing the United States Medical Licensing Examination. So they, on top of everything else, they have to pass something that gives them license to be able to practice in the United States. So I also want to stress here, I don't know if stress is the word, but something that obstetricians take a lot of time doing, or, that they learn a lot in their residencies, is performing surgeries. And that's good. You want them, should you need a surgery, to have done that surgery prior to working on your body, right? Or with an attending physician, so that it's absolutely being done correctly and safely and under proper care. But with that, as part of the surgeries, and you can imagine, if we're talking about babies, cesarean birth is going to be part of what they're learning and practicing during their residency. Now, some providers, and I would say it's very rare, some providers are going to have, very minimal training as far as it comes to cesarean births. Others, and I started looking into this, and I'm actually going to provide a link because it was really interesting to read through. Never do I ask my provider, which college did you graduate from? But some of these, as I'm reading through, I'm like, it wouldn't hurt to know, like, hey, what's your training? What's normal for you? What does that look like? But anyways, because some of them require up to 200 cesarean births performed within their 3 to 4 years of residency, which kind of blows my mind, because I'm like, well, that sounds like they're performing too many cesarean births, right? And so it brings me back to, like, yeah, for sure, there's too many cesarean births happening in the United States, and I wonder why. Hospital privileges also are sometimes granted to those, or sometimes they're not granted to those that don't have enough experience in the way of surgical cesarean birth. And so that's where I'm going to add that link to the show notes. You can kind of read through that. Hospitals will require different things from different providers. So it really just depends. And then there's, just because, I want to stress this too, just because a provider has gone through a certain amount of schooling, has trained with whichever physicians, and have done a certain amount of cesarean births, it doesn't mean that that's necessarily how they're going to practice, just because it was required through their program. However, I do think it gives them more of that medical eye naturally. Anytime that we're trained in something, or we do it a lot, we're familiar, like it's in our face a lot, this is what we're doing on the day-to-day, then of course we're going to be more prone to practice that way, see things that way. And to be clear about what I'm talking about when it comes to a laboring woman, sometimes an obstetrician is going to be much more aware of the things that could go wrong that would necessitate something such as a surgical procedure in the way of cesarean birth. Whereas someone who is trained in very normal, natural, physiological things of labor and birth may allow things to progress at their own rate without intervention as quickly or unnecessarily. So, for example, for a mom that has prodromal labor and then she has a really long labor and her contractions are not getting really too much closer together and it looks like there's not a lot of progress, how an OB, an obstetrician, would handle that versus how a midwife would handle that. And I'm talking typically because there are many obstetricians that are much more natural and there are many midwives that are much more medical. So generally speaking, you will find that an obstetrician is quicker typically, or in a hospital setting. This can happen especially with certified nurse midwives too. But more in a hospital setting, they're quicker to go to things that require some kind of medical intervention versus maybe an out-of-hospital midwife who's like, hey, let's try some different positioning. Let's go for a walk. Let's make sure that you're rested. Let's try this herb. There's a lot more of the like, actually, that's normal. And let's give this a try rather than that doesn't look right. It's not fitting into this criteria. And there's a bunch of things that might be going through their head, maybe insurance purposes or hospital policy or I don't know, whatever the case may be, they might lean towards, or safety purposes for them, how they're viewing the situation. They might lean towards more of the let's augment labor. Let's start Pitocin. Let's get you an epidural so you can relax. And it would just, the care would look different on the same woman in those situations. So all right, let's move on because I really want to just get into the nitty gritty of what these providers do and so that you feel really comfortable picking a provider for yourself. So did you know that medical doctors can attend births? And this was kind of a neat thing because you don't think of like your family physician as someone who can be at a birth. And interestingly enough, once I got into the creation of my essential birth, I actually had my family physician or my personal physician, who's a medical doctor, who said, hey, and at the time I was trying to conceive and have more babies. And we tried for a good long time, like 4.5 years. But anyways, he was like, hey, if you get pregnant and should you get pregnant, and you choose to have a home birth, he said, I would love to be your backup in case you end up in the hospital. And he was basically like, I will treat you well and with respect, and I'm only there in case of emergency. He goes, but that makes me feel better about you being at home and having that safe transition to somebody that you know at the hospital. And when he said that out loud, I was like, this is the gold standard of care. This is exactly what it should look like. Medical doctors, obstetricians, and out of hospital, anybody that is dealing with a patient should have excellent communication and a smooth transition. It shouldn't be anybody, you shouldn't have done this, or a power struggle, or this was better and that wasn't. It's for the care of the woman involved. And so when he said that, I was like, yes. And he has done cesarean births, which I thought was totally interesting. And he's done them safely and well. And so, I love that option. So if that is an option for you, I say absolutely look into it. Find somebody that can back up in that way. But family medical doctors, they care for patients with a variety of health needs, right? This is your person that you're like, I have strep throat or a cough or COVID or, whatever. And they range from infants to the elderly. They've got this wide range of dealing with all kinds of medical issues. In more rural areas, there might not even be an obstetrician nearby or very few to choose from. And so this is where family medical doctors can take on the care of a pregnant mom and baby. But I don't want to put it to just those rural places. You can do this right now wherever you're at, should you choose to. That's absolutely an option for you. So what's their training? They have to complete their bachelor's degree. So that's a 4-year degree, and they have to do it in a science-related field. They have to pass that MCAT, and they have to apply to and complete medical school and finish up with the 3-year residency in family medicine. So it's actually a really similar path to becoming an obstetrician. And for them, it's about 11 to 12 years is kind of that same thing. But they don't have a focus in that obstetric care. They have a focus in family physician care. And then they also, like every physician, have to pass the United States medical licensing examination for those that are here in the United States. Now, let's move on to a CNM, or a certified nurse midwife. And for this case, I'm going to talk about those that are practicing in a hospital setting, since most of them will be doing that. And that's kind of why they get their licensing and how they do it. But they provide care to women of all ages, and they are focused on gynecology and family planning services. So that's your birth control, that's your menstrual cycle, that's your hormones, all of that stuff. They can order ultrasounds and anything else that needs, further examination. They get to do that. They also provide your primary care, including annual examinations that can be like breast examinations or your pap smears, which now are not an annual thing, right? Like, yes, pap smears, but like you don't have to get the testing. Anyways, that was awesome. Conversation for another day. But they can write you prescriptions. They can offer nutrition counseling. They do, they take care of a woman and her body all throughout, and that baby, to be able to take care of those things. So they, as like a side note here, they cannot perform cesareans. They are not trained in surgery and nothing like that. And so let's talk about their training. First of all, they have to obtain a Bachelor of Science nursing degree. And then once they have that degree, they have to pass the National Council Licensure Examination. It's an exam that all nurses nationwide have to pass, and they can then begin to work as a RN, or a registered nurse. So it's similar to how a doctor in medical school needs to complete their residency. Once you're an RN, you have to gain at least 1 year of experience working as an RN before you can apply to a graduate midwifery program that's accredited by the Accreditation Commission for Midwifery Education. And that takes about 18 to 24 months to complete, and then you'll have your Master's of Science in Nursing. So it is about 8 years of schooling versus the much longer amount of schooling that the other physicians have. But it's very specific to working with pregnant women, and working with pregnant women specifically in a hospital setting. So that's kind of what that looks like. Final step to becoming a certified nurse midwife is to take the certified nurse midwife certification examination. And yes, there's a bunch of stuff that they have to do, but they've got their 4-year bachelor's degree, their 1 year of registered nurse, and then the 3 years of the nurse midwifery program should they get accepted. And then they have to have a licensed physician overseeing their practice. And as a reminder, they cannot perform cesarean births. So if you meet with a certified nurse midwife in your pregnancy at the hospital for your labor, and for some reason you do end up needing to have a cesarean birth, you will be transferred to the OB on call, or the obstetrician that's there at that time that can help perform that particular procedure. And then usually that certified nurse midwife would come into the operating room with you, so you wouldn't be fully left alone, but they just would not be the one performing that surgery. Okay, let's briefly talk about a certified nurse midwife that works out of hospital. They do all the same things that the certified nurse midwife that works in hospital does. They had to do all the same certifications and all the same schooling, all the same training, but maybe they choose to work out of hospital births with all that training and take it with them. So in most states, in 22 states, for a certified nurse midwife to be able to attend a birth outside of the hospital, they have to have oversight from a licensed physician. And that is probably what makes it really tricky for certified nurse midwives to perform out of the hospital. So in a way that is done legally, right? And this is kind of where we go back to those maybe underground midwives, which I'm not going to spend any time on with this right now, but just so that you're aware, that's kind of why there's not a ton of certified nurse midwives that work in the hospital that then choose to go out of hospital. I know that we have one here in Utah. I haven't looked at all the specific rules and laws and all that stuff. I know she does it legally here in Utah. And she's done it for many, many years. And she's like super holistic and natural minded, and definitely like out of hospital birth is her thing. But I love that she's got that CNM training too. I wish that we would make it more open, because I think so many women could benefit from having that knowledge brought into home birth as well. And, that would just depend on it's back to like, does this physician or does this provider fit what I'm looking for my birth? But I think for some women that could be like a really comforting transitional place for them to be. So it's unfortunate that we don't have that. It's not easier for them to do should they choose to work out of hospital, but it's not the case in all states. And there are areas where a CNM can attend home births. So that's kind of a neat thing as well. They can write prescriptions and do all the things necessary to care for mom and baby, only consulting a physician when they need to or want to. So in some states where you can work as a CNM out of hospital. All right. Now into the midwives. There are a couple different kinds, particularly that work out of hospital. And that's your CPM, your LDEM, and your DEM. A CPM is a certified professional midwife. They attend births out of hospital. That can be at a birth center. This can be at your home. They can do both, but it's an out of hospital midwife. Generally, they can't administer drugs, and that's going to include painkillers that are used with delivery. So you're not going to get an epidural out of hospital. That's not even an option. But they can prescribe antibiotics or medications that can prevent hemorrhaging or other issues or complications during pregnancy and during labor. So to become a CPM, here's what you have to do. You have to have a high school diploma or an equivalent, and you have to pass a competency test from the North American Registry of Midwives, or NARM, if you have heard of that before, or you have to graduate from a midwifery education program that is accredited by MEAC, or the Midwifery Education Accreditation Council. I am saying a lot of big words today, you guys. And then applicants can also qualify if they've got the CNM or CM credential. So a certified nurse midwife, should she choose to get the CPM, can kind of like transfer over and get the certified professional midwife credential and then practice as a CPM. So keep in mind here, and this is such a random thing, but like 6 states don't allow certified professional midwives to attend home births. And so that's where there can be some of those CPMs who continue to deliver babies underground despite those laws. And then should they get caught or whatever, that's where you're looking at the misdemeanor versus felony versus like literal jail time should these women get caught. It's kind of this controversial thing because women want their right to be able to birth at home. And there are some midwives who can help them safely do that, but states get in the way. And that's really not my soapbox today. It's just to help you understand what each does, but it is a thing. Okay, then we have the direct entry midwife. This is, or it's referred to as a traditional midwife. So this is your midwife that they don't necessarily have. It's not that they don't have, but it's not necessary to have any kind of college degree or background in nursing or any other training other than hands-on. Everything that they do is by apprenticeship and self-study and courses that they take about holistic care or herbology or aromatherapy or however they choose to get their education and knowledge and training. But a lot of it, the majority of it, everything comes from apprenticeship first. So they're going to be on the more natural side of things. They're going to be the ones using their herbs and growing their own herb garden to be able to help mom. It does not mean that they are not skilled. In fact, apprenticeship, when you think about the natural progression and physiology of birth and labor, there is a lot to be said for apprenticeship in this setting. In fact, some of these things that are required as far as, and I'll tell you right now, like I started a midwifery program and pulled back because my kids were little and anyways, and that's when this whole My Essential Birth thing came up and I went this route instead. But there are a lot of things that are under that certified professional midwife credential that are required that, in my opinion, don't necessarily make you a good midwife. And so some of those academic things or like extra knowledge, and you're like, that's great. But the hands-on stuff and the like reading a woman's body and understanding how her body works and what position she needs in to safely deliver her baby and then being able to resuscitate a baby or the emergency stuff after, some of that's going to be taught, but some of it, I mean, learning how to work with families hands-on, you can't find that in a book. And even if you could, it wouldn't transfer the right way. So there's something to be said about attending, hundreds, thousands of births versus reading about it in a book. So it doesn't mean, my whole point is to say that it doesn't mean that a direct entry midwife is not skilled. And they may go, the whole reason behind them not certifying or not, becoming a CNM or a CPM or whatever might be so that they can provide care in settings where those things would be illegal. So this was my midwife. She was a direct entry midwife. She was incredible. She was very skilled, very trained. And she purposely did not take on certification so that she could serve women in her community legally, in her case, to be able to help them have their home births and have birth in a way that they desired. So, in fact, she couldn't even charge for the birth. It was donation only because that would have made it illegal. And so we were aware of what a normal donation looked like on the low end and on the high end, and then we made a donation. So that's how that went. But so one of the reasons that you might be working with the DEM is not because she's not skilled, trained, or knowledgeable. It just might be to be really helpful to women. Now onto the LDEM, or licensed direct entry midwife. It's similar to a direct entry midwife. It's the same where you don't have to have a college degree or background or anything like that. They learn through apprenticeship, self-study, things of that nature. But they receive a licensure, which is granted on a state-by-state basis that allows them to carry medications like Pitocin and antibiotics for group strep. And so they can take care of hemorrhaging and things at home. They can, provide the antibiotics through an IV drip for mom at home. So in some ways, they have kind of this extra balance and ability to be able to take care of mom. Many of the CPMs here in Utah, for example, they also have the LDEM. And here I believe it's required. I don't know if this is everywhere, but here I believe it's required. In order to have the LDEM, they have to have a CPM with training in pharmacology. So, and I hope I'm getting that correct. So correct me if I'm wrong. But so it just depends on how that works. It's one of those state by state cases. But this is a midwife that has done that traditional apprenticeship training and can also carry medication that is good for mom and baby. Okay. Hopefully that was helpful. This might be an episode that you have to go back through and re-listen to. What I want you to get from this is not only the knowledge about the training and such behind the providers, but what sounds like it's going to mix well with you. And when you're going to meet with them, it gives you an idea of what kind of background that they have too. As I said before, I think a lot of what happens during labor is very normal and non-emergent and can be treated in a way that allows mom to work through kind of the new feeling and that labor land that we talk about, and maybe some of those discomforts and even pains of the process with more of an understanding of her body and what's normal, instead of treating it like something's wrong, your body's not working, something's broken, this isn't normal. It completely throws off where you're at in your mind, and that throws off your body physiologically. And so I want to be really clear, like I said before, it doesn't necessarily mean the people that are trained in the medical ways of doing things or in surgery in an obstetrician's case are necessarily going to put that on a birthing mom. However, the likelihood of it is greater simply because it's what they see all the time. It's what they deal with on a day-by-day basis. And so just being aware of that in those situations. And for some moms, it might be really comforting to know. For a lot of moms, it might be really comforting to know, I'm choosing to go to an obstetrician or I'm going to a certified nurse midwife, and they've got all of this training on all this hospital stuff. And they've done these residencies and they've seen these issues before, and I feel really safe and comfortable here. And then you can choose which one of those sounds right for you. And on the other side, having midwives who are out of hospital, this is their training, this is their background. Can they carry these life-saving medications? Does that matter to me? What kind of training do they have in transferring? And, I went over those kind of provider questions last time, but this was kind of like a follow-up to that, where it's those are great questions for those providers. Here's why, because this is their training and this is what you're looking for your particular birth. So as you listen to this week's episode, maybe you took some notes. Hopefully you've at least taken some mental notes. And I hope that it helps you choose a provider that is right for you and how you choose to give birth. That's it for this week, but make sure you subscribe to the podcast so that you get notifications first as I drop a new episode every week. And don't forget to head over to myessentialbirth.com for all of the free downloads mentioned here and to join the birth course and community serving pregnant moms just like you. If you enjoyed this and other episodes, I would love it if you would take a few minutes to leave a review on Apple Podcasts. I read every single one and include one at the beginning of each episode. See you next week.